Hi, this is QD Clinic, brought to you by RheumNow.live, being held in Fort Worth on March the 22nd, 23rd, 24th. Fort Worth has it all. It's a great walkable town. It's got two of the best museums in the world, the Kimball and the Amon Carter. It's got the biggest honky tonk in the world in Billy Bob's. There's a ton of things to do, including the stockyards. It's a great town for a meeting. Check it out. Our case today is called Who Gets a Vote? The Patient or Me? It's a story of a 35-year-old Latin female who's had rheumatoid arthritis for about 10 plus years. And she's been around the horn. She's taken a lot of different agents. She's had very severe refractory disease. She's got a lot of deformities that she's left with, including a lot of sublux joints, swan necks and boutonnieres, a few telescoping digits, sublux MTPs. She's been around the block on 3 or 4 different DMARDs, including methotrexate, Areva, and sulfasalazine. She's had 2 TNF inhibitors in the past, abatacept shots she's received. A lot of this was really without much benefit. And more recently, she's been on a combination of methotrexate, leflunomide, and taking infusions of tocilizumab. And she was doing well for about a year or so. And the last 2 visits she shows up, she's taking the same medicines. Nothing's changed. She's getting her infusions on time every 4 weeks. Her milligrams per kilogram dose is almost 7. It's about 6.9. In the last 2 visits, she's had 11 swollen and then 13 swollen joints. And then obviously many more tender joints. And she's really a bit of a mess. And when I see her, I say, you know what? It's time to, pull the handle on this dump truck and make a change. The question is, who makes that decision? It's my job to be dissatisfied with an unacceptable number of swollen joints or an unacceptable level of a CDI score or rapid 3 score, or in my case, a gas score. All of them were high. But ultimately, you got to convince the patient that's in the right and important move. I laid out the options for the patient, of which there are several, and you could list those in your head, both pills and shots and infusions. And instead, I told her that, or we could increase the Actemra dose from 6.9, adding another 100 milligrams, where she was going to be 8.3 or 8.4 milligrams per kilogram. And she said that's what she wanted to do. And I said, really? I said, I don't think this is a good idea. And she said yes. And of course, she came back, and I told her, we're making a decision in 6 weeks. In 8 weeks after your 2 infusions. And she came back, and I just saw her the other day. And what would you guess is her swollen joint count? Drum roll, please. Yes, it was 1. And I was wrong, and she was right. And the beauty of that is giving patients a voice in their decision makes them motivated to get better, gives them a positive attitude. I don't think that going from 13 to 1 joint can at all be a placebo effect, but I don't care if it was. I just like that I'm seeing only 1 swollen knee and nothing else, and she's very happy with how she's doing. So again, I think it is important to, even when there is a fork in the road and you think that the right choice is to go this way and not that way, and the patient wants to go that way, you know what? It's okay to let the patient go their way, but set some real limits on it. Meaning, what are we looking to achieve that would say that this is a success? What's the time frame in which we're going to make a decision? It's got to be fast, unless the drug itself is an incredibly slow-working drug. So I like the idea of giving the patient the choice, setting rules for reassessment, and coming back and finding out that she was right and I was wrong. It was a good day for both of us. That's it for QD Clinic. We got more coming.